I'm joined today by Mary Dojutrek, Patient Access Trainer at NorthShore University Health System in Chicago. Mary will be joining a session at our Revenue Cycle Learning and Development meeting taking place on Tuesday, June 20th, where she'll discuss key metrics and performance indicators with other panelists from the industry. Mary, thanks so much for joining us. Could you tell us a little bit about how you began your career in healthcare? What motivated you to work in this industry?
Sure. Right out of college, I started as a high school English teacher. It was such a great experience introducing ninth graders to masters like Shakespeare and Dickens. And it was a private school and limited teaching resources. So I was in charge of student council, clubs. I was the volleyball coach. So my husband said, for us to have a family, you have to be home once in a while. So I transitioned to business. I worked as a trainer at Allstate Motor Club, and I was teaching agents how to dispatch tow trucks across the continental United States. For a while, I was a stay-at-home mom, but then I returned to work at NorthShore University Health System as a trainer, training new employees and existing employees. And I really enjoyed that work so much because I think we're there to support success, to support others' success, and help them digest learning, because some things are complicated, but when you make it digestible and relate it to something they already know, and in addition to that, related to and make it an ounce of fun, that a spoonful of sugar does a lot, that they can really be effective in the workplace. I know they have the ADDIE model where it's analyze, design, develop, implement, and evaluate. I really think the evaluate should be effective. I need to be effective so that my students can be effective on the job, because that impacts their livelihood. So really, I just really love to support people and their success.
That's really wonderful. And tell us a little bit then about some of your main priorities for this year in your current role at NorthShore. What are you looking to do in this particular year?
So probably two of our biggest priorities this year are we are transitioning from SharePoint to Salesforce. And we are using Salesforce more as a content manager than as a custom relationship manager. So it's really changing how we look up information in our department. It will be a big change, but I think it will be a positive change, making it easier, certainly easier to maintain all of our contacts, locations, protocols. So that's one change that we are definitely working on. The other thing is our electronic medical record. We're trying to make it easier for both patients on the portal and our agents to schedule appointments. It shouldn't be as complicated as it is, so we're leveraging the technology, our emergency medical record, electronic medical record, to make it easier for everyone. Reps shouldn't have to sit there and try to figure out what visit type, what provider, does this provider see patients for that reason. So we call it decision tree scheduling. Some of our departments are there, not all of them. But basically, the PAR just asks the patients a series of questions, and the electronic medical record should generate the correct visit type for the patient, the correct provider, the correct length. And so that makes life easier for everyone. So those are our two big initiatives that we're working on this year.
Wonderful. And would you say that with the technology, with the decision tree scheduling, that's going to help reduce also errors that might occur in registration and other parts of the patient's medical record?
Most definitely. And I think that's always the goal, to leverage the technology to avoid human error whenever possible.
Definitely. Well, we're really looking forward to having you join our metrics panel at the Revenue Cycle Learning and Development meeting on Tuesday, June 20th. And looking forward to the panel, is there anything in particular that you're looking forward to discussing or benchmarking with the industry panelists and with the other attendees?
I think as a contact center, we are so filled with metrics, whether it's quality trends, error trends, average handle time, so that we can be more efficient, so that we can help more patients. And then there's service level. What percentage of our calls do we answer within how many seconds? So of course, I'm interested in all of those metrics across other organizations. But I think the one thing I'm really interested in is how are organizations, their talent and development teams, how are they reducing attrition? Especially in a contact center or revenue cycle where sometimes entry-level positions and the turnover can be high. What methods or ways have they utilized successfully to reduce attrition?
I think that's a great point, and I think that's something that everybody will be looking forward to talking about. And again, we really look forward to having you on the panel and appreciate you taking the time today to introduce yourself to the audience.
Thank you very much.
Thanks, Mary.